The World Health Organization is reporting an outbreak of the Marburg virus in both Equatorial Guinea and Tanzania. The CDC is now warning travelers to take precautions if they visit countries where the virus is spreading. For the first time it has appeared in Tanzania, and the news comes weeks after the disease was reported for the first time in Equatorial Guinea. What is Marburg virus? Marburg virus disease, MVD, formerly known as Marburg hemorrhagic fever, is a severe disease in humans caused by Marburg virus, MARV. It is a highly infectious virus that belongs to the family Filoviridae, which also includes the Ebola virus. It is named after the city of Marburg, Germany, where the first recorded outbreak occurred in 1967. The virus causes a severe and often fatal illness called Marburg virus disease, MVD, which is characterized by symptoms such as fever, chills, headache, muscle aches, and a rash. The virus is transmitted to humans through contact with infected animals, such as fruit bats or monkeys, or their bodily fluids, such as blood or urine. Human-to-human transmission can occur through direct contact with the blood, secretions, organs or other bodily fluids of infected individuals. Is there a treatment for the virus? There is currently no specific treatment for MVD, and supportive care is the mainstay of treatment. Prevention measures include avoiding contact with infected animals and wearing personal protective equipment when caring for infected individuals. Where is it mostly seen? Marburg virus has been primarily reported in African countries, including Uganda, Kenya, Angola, and the Democratic Republic of Congo. Outbreaks of Marburg virus disease have occurred sporadically since the first known outbreak in 1967, with the largest outbreak reported in Angola in 2005. Due to the potential for high morbidity and mortality associated with Marburg virus disease, it is considered a public health threat and is closely monitored by health authorities. Symptoms and effects on people. Marburg virus is highly dangerous and can cause severe illness and death. The mortality rate for Marburg virus disease, MVD, can be as high as 88%, according to the World Health Organization, WHO. The symptoms of MVD are similar to those of Ebola virus disease and can include fever, chills, headache, muscle aches, and a rash. As the disease progresses, patients may experience severe bleeding, multi-organ dysfunction, and shock. MVD is highly infectious, and the virus can be transmitted through contact with infected bodily fluids, including blood, urine, and vomit. Therefore, healthcare workers and other individuals who come into contact with infected individuals or their bodily fluids are at high risk of contracting the disease. However, it is important to note that while Marburg virus is highly dangerous, outbreaks are relatively rare and sporadic. Furthermore, with appropriate infection control measures, the risk of transmission can be minimized, and the likelihood of a large-scale outbreak can be reduced. What are the steps to be protected? There are several steps that individuals can take to protect themselves from Marburg virus. Avoid contact with infected animals. Marburg virus is believed to be transmitted to humans through contact with infected animals, such as fruit bats or monkeys. Therefore, individuals should avoid contact with wild animals, and they should not consume bush meat. Practice good hygiene. Marburg virus can be transmitted through contact with infected bodily fluids, including blood, urine, and vomit. Therefore, individuals should practice good hygiene by washing their hands regularly with soap and water, and by avoiding contact with the bodily fluids of infected individuals. Wear personal protective equipment. Healthcare workers and other individuals who come into contact with infected individuals or their bodily fluids should wear appropriate personal protective equipment, such as gloves, masks, and gowns, to minimize the risk of transmission. Seek medical care if you have symptoms. If you develop symptoms of Marburg virus disease, such as fever, headache, muscle aches, and a rash, seek medical care immediately. Early diagnosis and supportive care can improve your chances of survival. Support public health efforts. Public health efforts, such as surveillance and contact tracing, are critical for detecting and containing outbreaks of Marburg virus disease. By supporting these efforts, individuals can help to minimize the impact of the disease on their communities.